Hi, my name is Kelly Halley, and I'll be going over some study strategies for Dr. Chandley's Human Anatomy class. All right, today I am going to go over one of the study strategies that I frequently use for the Human Anatomy class, and that is drawing. Sometimes I use the human body to draw on, other times I use a sketch pad. For purposes of this project and for learning the bone markings of the skull, I have chosen to do drawing on my husband. So we're going to start by going over some anatomical landmarks. The first being the Frankfurt plane. The head here is in the anatomical position when the inferior margins of the bony orbits and the superior margins of the external acoustic meatuses are in the same horizontal plane. That is the Frankfurt plane. And that is right here. All right. And secondly, which is another clinically useful feature of the head, is the vertex. And that is shown right here in my drawing, and it goes all the way to the top here. All right. Now, the vertex is the highest point of the head in the anatomical position, and it marks the approximate point on the scalp where there is a transition from the cervical to the cranial innervation of the scalp. The anterior to the vertex, the scalp and face are innervated by the trigeminal nerve 5. Posterior to the vertex, the scalp is innervated by branches from cervical spinal nerves. Okay, now another area that I would like to make note of is the occipital bone, and that is in the posterior area of the skull. Centrally, the flat or squamous part of the occipital bone is the main structure in this view of the skull. It articulates superiorly with the paired parietal bones, which you can see there in purple on either side. And the paired parietal bones also have the rhomboid suture, and laterally with each of the temporal bone at the occipital mastoid sutures, which can be seen right here. This is the occipital mastoid sutures. Okay, and next I'd like to go over the temporal bones. Laterally, the temporal bones are visible in the posterior view of the skull. Seen here, you can see those in green. And laterally, you can also see them in green. And the temporal bones include the mastoid notch here, and also the mastoid process. You can see that on both sides of the head. There's the notch and also the mastoid process. On the inferior medial border, where the mastoid process and mastoid notches, the mastoid notch is the point of attachment for the posterior belly of the digastric muscle. Again, on the inferior medial border of each mastoid process is a notch, that is the mastoid notch, which is a point of attachment for the posterior belly of the digastric muscle. Next, the frontal bone, shown here. The parietal bone and occipital bone are seen in a superior view of the skull. So here, tilting the head just a little bit, you can see the occipital, the parietal, and here the frontal. Now, your head up again. Okay, there's a good view of the frontal bone. Here is a good view also of the coronal sutures, the sagittal sutures, And moving laterally again, we have the squamous sutures right here. Also, here's the outer sphenoid bone and the zygomatic bone. And that's right around the orbital area of the eye, which I just barely have outlined in black here. All right, just to recap, we have the frontal bone, the parietal bones, the vertex, the Frankfurt line, the occipital bone. Right around here we also have the foramen magnum. Got the mastoid notch, mastoid process, and again that is where the gastric muscle attaches. All right, thank you.